So the first, investment. Now, so you're going to say to me, where did I get these investments from? Hey, I thought them up. The first investment that any government has to make in the life course is universally accessible, that is free, strongly promoted, and high-quality family planning, pre- and perinatal care, including effective breastfeeding, promotion, and support. So if we just look at neonatal deaths, we see that from 1970 to 2010, we get this pretty much exponential decline with a plateauing, which is true of all developed countries. Further major declines are not likely. And what you see here is that Scotland is down below 3. So this is a good news story, but I haven't shown you anything but the overall average. I haven't shown you the socioeconomic differences in the two countries. And of course, they've both been coming down. Actually, the poorest have been coming down a little faster in absolute terms, and so the gap has narrowed. But they're not nearly as far apart as Scotland's exact same social classes. There's a gap that has not been, it's come down, but it's still there, and it's still bigger than the other country. This is the rates of breastfeeding in the 5 quintiles of Scotland's index of multiple deprivation for all addresses, home addresses. When breastfeeding is properly measured, it changed the upward and downward social mobility of the children massively. And there is something definitely about the breast for many Scottish women, particularly who have less education, because they do tend to think of it as yucky. This is all of the low birth weight babies in all of the babies born each year. The pink line at the bottom is the rate of low birth weight babies for the wealthiest and most educated 10%, and the line at the top is the poorest. And the top one looks a bit like Harlem, 2 completely different worlds. Most you could expect to reduce prematurity on the basis of implementing all that we currently know about it is a 5% reduction. So what happened here, 2006, a miracle happened. Well, it turns out that when they banned smoking a year ahead of England, reduced premature births almost overnight by 11%. It wasn't known that secondhand smoke is a precipitant of labor. I mean, let's face it, infant mortality, while terrible and tragic, is now too rare an outcome to be of great public health interest. So we need to stop focusing on the graveyard and move upstream. Claude talked me into trying the EDI in Scotland. It performs exactly the same way there as it does in Canada and Australia and every other place it's been used. Second investment, and I'm going to have to speed up now. I spent a lot of time on the early life one. So what's happened is that the top half of the income distribution in the UK has made more money every year until the last few years. The poor are not moving anywhere. You cannot improve the poverty rate very much because it's structurally set. Now, I'm switching just for a minute to pensioner poverty because that's the other end of life where we can see whether a society is humane. What happened in Canada? Brian indexed the pension, and now Canada has one of the lowest rates of elderly poverty in the world. It shows you this enormous power that taxes and transfers do, like an indexed pension, to bring down poverty rates to under 5%. If you want to see the right model, go to Holland. Every neighborhood has a center with a pedagogue with bachelor's level training in early child development. They would say, oh yes, it's just because Sweden and the Netherlands and they're all just more equal. Everything's more equal. It just permeates. It's like miasma. The truth is these countries have had for decades near universal pre-primary education of the sort I described above. So when kids hit primary school, they're way more equal in their ability to learn and function. That is the official school inspection agency of the UK. Those are school inspectors. They're not the radical socialist league. 20% of Scots were functionally innumerate and illiterate. And if you're not sure whether it's 20% in your society, see if there's somebody run the EDI on it. It really, really tightly predicts later school success and therefore your life course chances. So is there a study that helps us make the case that free medical care really can bring down health inequalities? Yes. What they did was they did a very simple thing. They partitioned the deaths in Canada for this 25-year period after Medicare was fully implemented. And what you see is this amazing decline in both men in the black dots and women in the round circles. I think it's important to be able to say that free medical care does matter, and it matters particularly as you get on in life, because a lot of stuff suddenly hits you. You didn't get a chance at prevention. We need to understand functional aspects of the population. And I dedicate this talk to Clyde and to all of you out there working hard to achieve that goal.